Hello, my name is Lacey Egnew. For this video presentation, I will be focusing on interprofessional collaboration and using my own experience along with a few studies done to help ensure the cohesiveness of collaboration between professions. I have recently been collaborating with nurses at different levels, both RNs and LPNs, along with multiple doctors, management personnel, and dietary staff to help bring back a few educational programs to the rural area that I work in. Through multiple meetings and working through these projects to in turn be reviewed by my collaborators, we've been able to bring these programs back to our area that were previously shut down. After determining the need for the programs such as a lactation and childbirth education class, my boss tasked me with the project of starting to bring this program back up from scratch. There were no records of any presentations or projects showing what would need to be done, except in one particular policy that also needed to be revised. At this point, I knew that I had never done something like this before, and I would need some help. Because of my acceptance of needing help, I pulled in the dietitian to help with the nutritional aspect, and I pulled in another nurse that is very passionate about diabetes to help provide education about gestational diabetes specifically. As encouraged by CRMC and his colleagues, written in 2022, the awareness and knowledge that help was needed strongly influenced my request for help. I knew that I was going to be able to do this on my own. Once I had the basics of my PowerPoint together on policy, I was able to request help from a doctor to ensure that I was giving the most accurate information. One of the doctors that I collaborated with brought up a very good point after reviewing my work. She noticed that the language that was used was wonderful if everybody had my education level. Due to the area of my hospital, we are located in a very rural area, so there are a lot of blue-collar workers, farmers, tradespeople. This brought into light that I needed to level down the language so that more lay people could understand what was being said. This helped to ensure that most people would benefit from this class because it would not have them struggle with understanding what is being said. With the help of my fellow nurses, doctors, and a dietitian, I was able to put together a presentation that would benefit the community. One aspect of collaboration that could have been improved was coming together as a team before I began the PowerPoint presentation, as it would have prevented a lot of extra work for myself and coworkers. After I made the original PowerPoint, it was decided that a lot of the information that I had put in there would need to be taken out as it was just too information dense. The overall project would be better off split into two presentations, one for early pregnancy and then the childbirth education. Having this information beforehand would have been beneficial as it would have saved me time, allowing me to work on other projects that I have also been involved in. Overall, having a collaborative meeting beforehand to go over what information should be provided for that specific class, meaning the childbirth education class, would have been beneficial for everyone involved. Taking this project on my own was beneficial to the team as it would help get it going faster, but it did not help with the time management and editing that had to be done once the presentation was finalized for review. According to the study by CRMC and his colleagues written in 2022, quote, before being able to collaborate, caregivers need to accept working as a team, unquote. As previously stated, if a meeting was set before the start of the project, it could have ensured that there was more of a team approach and ensuring that time was managed better and less editing was needed. This project was done while I was on the clock. The financial resources that were used were the time that I was being paid for while working. As for human resources, if the project had been divided up between myself and a few more of my coworkers, it could have been completed sooner. Solero and Buell wrote in a study in 2021 on enhancing professional collaboration, and they noted that barriers such as excessive workload and inadequate time can affect collaborative efforts. Due to having to divide my time between patient care and side projects, having another person or two would have helped to ensure that the project got done and implemented sooner. Having a team meeting to improve communication and have a structured plan in place would have been something that could have improved the women's healthcare team to achieve their goal of getting this childbirth education class going. Being the lead of this project, I was able to get the team together to sit down and discuss what was needed to ensure the project would include all of the information that was needed. Vatten and Dahl, written in 2022, provided some more evidence that clear and structured communication between nurses and doctors have a significant impact on patient care. This can be extended to the example of providing education to patients. Having doctors and nurses communicating clearly can significantly help ensure the patients are taken care of in all aspects during their education, or including their education. Collaborating on these projects can help encourage mutual trust and respect between the interdisciplinary team, according to the writings of Batten and Dahl. By taking this project to my team of doctors, nurses, management, and the dietitian, I was able to help us all communicate and bring together what we all thought the needed education was and what we figured could be saved for the next time, or the pregnancy class, I should clarify. The collaborative efforts of having a team meeting and discussing the project as a whole has brought together our team and helped to foster mutual trust and respect, showing that our team is dedicated to providing the best care we can to our patients. In conclusion, I believe that setting up an interdisciplinary team and requesting a meeting would have been beneficial to everyone involved, as it would have helped to create a more solidified plan and even assign specific roles or tasks, as suggested by CRMC and his colleagues, written in 2022, to help prevent the issues of having to revise the project after it was originally presented, thus increasing efficiency.